Hello, I'm William Krebs, DO, RDMS, EMTP, Medical Director, and I am one of the EM physicians here at St. Vincent. Here to talk today about the current state of Ohio practice guideline change and with respect to administration of IM epinephrine for the EMTB without the use of an autoinjector. Of course, if patients have their autoinjector present, it is always preferable to use said autoinjector for caring for your patients when it is available. This will not be the case in most cases though, and we want to make sure that our patients have access to IM epinephrine, a life-saving treatment in the right doses for anaphylactic reactions. You'll see today we're going to discuss adults, pediatrics, and infants. These will correlate with both the adult protocol and the pediatric protocols in the Northwest Ohio EMS Consortium protocols. We're going to discuss how to give the medication, the appropriate way to give the medication, including drawing it up with our current syringes. So today what we're going to be covering for our adult patients is the supplies you will need to administer IM epinephrine according to the adult protocol. As you can see here, we have the medical director, one of the medical director approved syringes. As you can see, it has markings at 0.1, 0.15, and 0.3 mLs. This will help you to make sure you're not overdosing and giving the appropriate amount of IM epinephrine for your patients. For the adult, per the protocol, the max dose and dose we are going to use is the 0.3 mLs of 1 milligram per ml of epinephrine. So, as we talked, we are going to take a patient who now is having an anaphylactic reaction per our protocol and is going to need IM epinephrine. First, we're going to have our syringe. We're going to take our 25 gauge needle and our 1 milligram of IM epinephrine. Be extremely careful, you do have a sharp here. You're going to pop the top off your epinephrine. Draw back to the 0.3 ml mark. Insert. Push the air in and now draw back. Tapping the syringe to get the bubbles out. It may take a few times to get the bubbles completely out, but again, we want to make sure we're doing this right. Now, you have your medication drawn up. Just like you would be doing and how we learned in class with our autoinjectors, we're going to take the lateral thigh, find the vastus lateralis muscle if you're interested in physio. Find it, take your syringe, inject into the muscle, draw back, making sure that you are not in an artery or a blood vessel, and inject your IM medication. Upon withdrawing, cap your needle so you do not get poked or stuck, and no one on your crew will get poked or stuck. Because you have additional doses available, should you need a second dose of epi for a long transport, you would have up to 3 adult doses that you could give in the same manner. Now we're going to be discussing our pediatric dosing for epinephrine. This can be found in tab 5 of the protocol. For this, doses are going to be smaller. Think if you are using or going to use the IM EpiPen Junior that is typically for the 5 to 15 kilogram range, this would be the dosing for IM for you. Of course, if you have access to the patient's IM auto-injector, it is preferred to use that than doing a draw-up injection of IM epinephrine for pediatrics. For our pediatric patients, the same syringe approved by your medical director can be used, as well as the 1 milligram per ml epinephrine, as well as we're going to use the 25 gauge needle. Based on the indications for IM epi, we have identified that our patient is having an anaphylactic reaction and needs a dose of IM epinephrine. For this, the patient would typically be a EpiPen Junior candidate. And for that reason, the pre-labeled syringe has markings at 0.15 mLs that will correlate to the same dose as your EpiPen Junior. In the same way, we're going to draw up our epinephrine, starting and of course we're going to need to get the air out of our syringe. And again, we're going to fill to the 0.15 ml line. Be careful, we have a needle that is sharp. In the same locations we would use with our EpiPen Junior, we're going to identify the lateral thigh, that vastus lateralis. Going to take our needle, just like we would with an EpiPen Junior, inject into the muscle, drawing back to ensure we are not in a vessel, and injecting our IM epinephrine dose. Cap your needle to ensure that nobody is injured on your crew, and monitor our patient for any signs of anaphylaxis that continue. You may need to repeat the dose for long transports. And then, of course, proper documentation of the IM epinephrine is critical. This is our infant administration for IM epinephrine. This is going to be an extremely rare case. Hopefully you never have to deal with it. However, if an infant is having an anaphylactic reaction, life-threatening anaphylactic reactions where you do not have the ALS backup you need, this is going to be a life-saving procedure with the use of IM epinephrine. This will be an IM administration of epinephrine for infants using our pre-approved, medical director approved epinephrine drop syringe with the pre-labeled marking of 0.1 mLs of 1 milligram per ml epinephrine. For this, you're going to again use your 25 gauge needle. Be careful, again, we have a sharp. Uncap your epinephrine vial. Draw up and remove any air bubbles until you are at the 0.1 ml. In the same way as the pediatric and adult, you're going to find the lateral muscle of the thigh, vastus lateralis. Inject into, draw back, make sure you are not in a vessel, and inject the IM epinephrine, capping your syringe so that no one gets poked. As we mentioned, administration of IM epinephrine can be life-saving. Documentation and appropriate utilization is important. For the Northwest Ohio Consortium and at the advice of your medical direction team, it is absolutely critical that in order to perform this skill, you must have initial training and concurrent training every 6 months to maintain proficiency in this procedure. If you do not have or cannot maintain these credentials or proficiencies, it is advised that you only administer IM epinephrine with an auto-injector or call for your ALS backup as soon as practical, or get the patient to the nearest hospital as soon as practical to get the life-saving IM epinephrine that they will need.